Welcome to the AUSS video series on an introduction to clinical procedures. This video will introduce you to the basics of venipuncture using a syringe. These videos are only to be used to supplement clinical teaching, and adequate supervision is still required when performing these procedures for the first time. You'll need the following: a tourniquet, gloves, alcohol swab, needle with syringe, test tube, cotton wool and tape. As you approach the patient, make sure you firstly introduce yourself and obtain consent. Then wash your hands and assess the arm and cubital fossa for a suitable vein. Usually the cephalic or basilic veins are chosen. Then put on your gloves. Fasten and tighten the tourniquet, being careful not to pinch the patient's skin or cause discomfort, and then recheck the position of the chosen vein. Swab the site of insertion and allow at least 10 seconds to air dry. Retract and tighten the skin with your non-dominant hand. With your dominant hand, insert the needle at an angle of between 10 to 15 degrees with the bevel facing upwards. Once you notice a flashback of blood into the syringe, advance the needle no more than another 1 to 2 millimeters. Hold the needle steady with your non-dominant hand and pull the plunger back with your other hand. When you have the desired amount of blood, release the tourniquet. Place cotton wool onto the wound and withdraw the needle. Then ask the patient to firmly hold the cotton wool in place for you. The safest way to transfer blood into a test tube in order to minimize the risk of needle stick injury is to firstly dispose of the needle into a sharps container. Then open the top of the test tube and gently transfer the blood before properly recapping the tube. Lastly, make sure the patient's wound is adequately dressed with tape or a band-aid. Then rewash your hands after patient contact. Thank you very much for watching and good luck. Please visit our website and leave us some feedback.